We at ABP Education Admission Fair are really delighted to have our webinar today on opportunities in health science. Before we begin, we would like to thank our webinar partner, Sister Nivedita University. I would like to begin with introducing our esteemed panel for the evening. Today, we have along with us Dr. Abhik Banerjee. Dr. Banerjee comes with almost 10 years of experience as a consultant pathologist and is currently the Zonal Technical Chief of East Zone in Apollo Diagnostics under Apollo Health and Lifestyle Limited. In his current role, he is responsible for the technical operations of all laboratories spread across East India. Before joining Apollo, he was the Chief of Quality, Section Director of LCMS-MS section, as well as the Nodal Officer, COVID-19 Cell in Suraksha Diagnostic. Dr. Banerjee has also worked with SRL Diagnostics, Central Clinical Reference Lab, Mumbai, and Rajwari Hospital, Ghatkopar in Mumbai. He is experienced in facing and handling CAP, NABL, and various CRS audit. We welcome you, sir. Along with him, we were also supposed to have Dr. Paul from Susrut Eye Hospital. However, due to his health reasons, he's not here with us. But we still have a representation from Susrut. We have Dr. Majumder with us. Dr. Majumder is a vitreo retina consultant at Susrut Eye Foundation and Research Center and is an eminent faculty of the courses that are ongoing at Susrut. Along with him, we have Professor Dr. Dhrubajyoti Chattopadhyay. May I please request sir to turn on his camera? Thank you so much, sir. Dr. Chattopadhyay is currently the Honorable Vice-Chancellor of Sister Nivedita University, Kolkata from January 2020 onwards. Professor Chattopadhyay has over 4 decades of experience in the educational sector and has been an instrumental player in strategic development of the educational landscape. He was the founder Vice-Chancellor of Amity University, Kolkata from 2015 to 2019 and the Pro-Vice-Chancellor of the Calcutta University from 2008 to 2015. He was also the director at the Center of Research in Nanoscience and Nanotechnology at the university from 2007 to 2015. Professor Chattopadhyay was the Dean Faculty of Science at the University of Calcutta from 2003 to 2007. We are really, really delighted to have you on board, sir. Lastly, we have our moderator for the evening, Dr. Niloy Sarkar. Dr. Sarkar is a professor and Dean Academics and Dean School of Health Science at the Neotia University. Dr. Sarkar comes with over 21 years of rich experience in academics and healthcare industry. Prior to joining the Neotia University, he was Dean Academics in NSHM campus and was with the CK Birla Group of Hospitals in different capacities during the years 2000 to 2005. He is a visiting professor of BITS Pilani and remained an advisor for UNICEF-sponsored health projects to the state government. He is also an internal auditor of NABH, Quality Council of India. He is a core committee member of CII New Delhi and health subcommittee member of ICAI New Delhi. We are really delighted to have all of you on board, and I look forward to a really insightful session for all those students who are wanting to pursue a career in health science. I would like to hand it over to Dr. Sarkar from here. Thank you so much, sir.
Thank you, Ms. Jaswal, for wonderful introduction of all the panelists who are present over here. I believe my voice is audible to all of you, that audience. And at the outset, I should thank to this ABP Education for arranging such a wonderful interactive session. And I believe this interactive session will be much beneficial for the aspirants who are interested to for that health science, any branch of health science for their career at graduate or undergraduate level. So this that is health science is basically one of the fastest and one of the largest sector in this entire world. If you see that growth rate of healthcare industry, it is tremendous growth at present. Just a few days back, I was just coming across one statistics of McKinsey. They have projected that the healthcare growth will be more than 18 to 28% in this financial year. It got that momentum more because of this prevailed COVID situation. So this COVID situation probably has created a lot of hindrances and then a disturbance in other sector. But unlike to other sector, health sector got that benefit. Okay, so whatever it is, so that is not important. Important is that I want to interested to project that healthcare is one of the finest sector for developing the career of any aspirants. Now today we have we are interested to focus our entire discussions on specifically few particular domain. So one of them is physiotherapy, one of them is nursing, then lab technology, and then we'll be also discussing some allied other field also. If there is any aspirants interested to get any idea of any other field of health science, we are also interested to address that kind of questions as well, right? So, if I just start with, I'll be asking a brief about that what is the prospect and the insights of healthcare from one of our panelists, Dr. Banerjee. Dr. Banerjee, if you just say a few words about what are the prospect of health science programs like optometry, like medical lab technology, like imaging and radiology, like physiotherapy. So if you can say a few words, Dr. Banerjee.
Yeah. Good afternoon, everyone. And first of all, I immensely thank the organizers, ABP Education, and also for arranging this kind of program, which is really helpful for the career growth and potential. And it's really very encouraging for the students also to be associated with such kind of program. Thank you, the Professor Dr. Niloy Sarkar, for your question. First of all, I would say yes, healthcare, as you rightly said, it's a tremendous potential and it's growing like anything, even in India, due to medical tourism and also the low cost of manpower, as well as the rapid improvement of IT and infrastructure in medical, in health care organizations. People are getting more and more interested. However, we all know that whatever the infrastructure improvement, be it in the laboratory, be it in the physiotherapy, be it in the nursing sector, optometry, whatever, in overall diagnostic or therapeutic healthcare, the main important is man behind the machine. So we need good manpower. Unless we do not have competent manpower in such organizations, definitely the purpose of this healthcare will be entirely lost. So we need students who are, we also hope that people who are attending this kind of session, from them only we will get very good competent manpower in India and we'll be able to move forward. Regarding the prospect and career aspect, I will say that we all have seen the COVID-19. We have faced this, but this is, and we have there are many troubles, many problems at the same time. This COVID-19 pandemic situation only has been able to re-highlight, or it's an introspection for all of us, how important is healthcare sector. What is the way, the significance, the importance of healthcare system, which was little bit, sometimes it's forgotten or it's a little bit sidelined. Now it has been come into picture once again like anything. And this is the industry. It is moving faster, and not only faster, like the fastest, and definitely it is going to be on the topmost sector of any industry, be compared to other industry, automobile, IT, or whatever you say. So there is every opportunity for the students who want to pursue this kind of career. And basically, I will say regarding laboratory technology, like for example, there are several government organizations as well as private organizations which are affiliated to some state medical faculty of West Bengal. They are doing a marvelous job. I would say my colleagues are there, the fellow panelists are there who are also conducting such kind of course. There are many organizations who are giving this kind of trainings and etc. And after completion of training, which is very best of these things, that they are only hiring these people. And this is very important, because once you get training from these kind of institutions or organizations, it will be best if you get hired in the same company. And even if you do not, you have multiple opportunities throughout West Bengal. As far as I can remember, for only this kind of laboratory technology courses, state medical faculty approved both government and private organizations are total around more than 80 to 83 organizations. So they are conducting the courses and they are also hiring people for this. So the salary structure has definitely improved because people has realized now the management has also given a very good, performance appraisal to the already existing technicians. So the opportunity is immense. And I will say in like DMLT, BSc MLT, whatever the BMLT courses are available now, microbiology, molecular biology, all labs, every laboratory is coming up with molecular biology, microbiology department for PCR related tests and those things. So there are lots of opportunity, and almost everyone who has done a course from a recognized university, that is very important. From a recognized university, they will definitely get absorbed. I do not think a single person will be left without any job.
Correct.
So there is immense, and in last 2 years, I think there has been remarkable improvement in the salary structures also. Good organizations, they are giving other facilities. They are recruiting as a full-time employee on payroll. So they are getting a very good process.
Okay, so thank you, Dr. Banerjee. You have very well explained, about the laboratory technology, programs, and what are the prospects. Also, you have very, nicely you have depicted. So, along with Dr. Banerjee, we are also having one of the eminent educationalists with this, panel. He's a professor, none other than Professor Chattopadhyay. Professor Chattopadhyay, as you are one of the eminent, educationalists, at least in this part of this, country. And we know that you're also predominantly in health science domain. So what is your view about the prospect of different programs in health sciences? I have seen there are a lot of universities are coming up. They are also started a lot of programs from that particular field. So what is your view? Why a lot of universities are starting these healthcare programs? And I've seen almost all the universities they have started maybe even down the line, maybe say last 2-3 years. They've all preparing themselves to start with that healthcare programs. So what is your view? What is the reason behind it, and what is the prospect of this kind of programs?
Thank you, Professor Sarkar. I must actually congratulate the ABP for organizing this very interesting interactive session, because I am sure that you are absolutely right that this year we have to look at the opening of all the different types of courses which are earlier not considered so lucrative. Now, why? Now, to my mind, that it is COVID-19. The COVID-19 pandemic has shown us the deficit of our knowledge in combating the disease, and has also acted as a catalyst in accelerating the changes in our understanding the healthcare system. Rightly mentioned by Dr. Banerjee, that when we are looking at this, the metamorphosis has led to a new type of healthcare delivery model with a greater emphasis on preventive measures, remote care, technological advancement, particularly on the area of artificial intelligence and sensing technology. Now, when we are talking about, so far we are talking about School of Life Sciences. What we mean by School of Life Sciences, we normally have the, earlier it's the classical department, zoology, botany, physiology things. After that, now the new subject areas also started to come 40, 50 years back, microbiology, biotechnology, and they are trying to actually getting more and more importance among the students. Yes, so many people are interested to study those things. But you know that recently this nutrition, applied nutrition, is really, I think, becoming very important. And we learned a lot about it. But when we're talking about this School of Life Sciences, which is connected with, say, for example, the pharmacy department, the nursing department, but the healthcare technologies, those things are very, very important. Dr. Banerjee rightly mentioned, see, earlier, School of Tropical Medicine, or they are conducting certain courses like this. After that, the University of Health Science, they introduced these courses. And these courses, after those introduction, I really thank the then Vice-Chancellor Babatosh Biswas for actually taking the initiative for actually introducing these things. But then again, these paramedical courses among the normal 10+2 students who are going to medical, that's fine. Who are going to biotechnology, that's fine. But paramedical courses as a very important career prospects are only started to be considered when we are talking for the last 1.5 years where we stand. We're standing at the region where really throughout the world, it's not only in our country, we can see that throughout the world, this is actually lacking. And thereby, when we talk about this, this becomes very, very important. See, there are the things which we are actually bringing today of the different sectors. I think what I want to mention about the critical care technology, say for example. Now, this critical care technologies has got a variety of roles to play, and they work in a different type of healthcare settings. They take care of the equipments and the monitoring devices that are used by patients requiring the intensive care or are in a critical condition. You know, the dearth of these people felt so strongly during this time. We are absolutely not prepared. And if we have people trained with this, it's not just nursing, it's not just giving the support to them, but these are very specialized trainings that needed. And this program of critical care technology, it allows the students to develop the most effective practical understanding, the use and operation of various critical care products and equipments. Cardiology, where they can learn electrocardiogram, echocardiography, computerized treadmill, intra-aortic balloon pump, and extracorporeal membrane oxygenation. This ECMO, how many of us actually know about these particular people? Now, the intensive respiratory care and their, for example, the mechanical ventilators, non-invasive ventilation, these are the terms we came to know from the newspapers and everywhere. But we now know that how important this is. So a person who has got this training, they are going to be the asset of the healthcare system. That's why this undergraduate program in critical care technology is going to be very, very important and very beneficial for the society itself. And there are growing scope to all the different hospitals, nursing homes, and other healthcare system, that how we can actually give people to them who has got this type of training. Similarly, you know, the medical laboratory technology already, Dr. Banerjee mentioned the medical laboratory technology, the types of technology with respect to the PCR, real-time PCR, rapid testing of antigens and others. These are highly specialized. There are automatic biochemical parameters, those machines are available, automatically they give results. But these are the certain things which we now understand is becoming very, very important. And if you consider that right now, this healthcare sector one is the lifestyle disorders. The lifestyle disorders are becoming so, we have to do it regularly amongst ourselves, and we have to check for that. And thereby, this medical laboratory technologies, as Dr. Banerjee very rightly mentioned, we need a large number of this type of trained people right now.
Correct.
Similarly, if you look at the medical radiography and imaging technology, it's becoming so important right now. When the CT scan is going to be analyzed, there are not really large number of people who are available to actually look at it. So the course curriculum of this medical radiography and imaging technology, which includes in-depth study of radiographic and image processing techniques, the conventional radiological equipments, the modern radiological and imaging equipment, the contrast and special radiography procedures, all these things, and how to interpret the results, think vitally and draw logical conclusions and help the clinicians to have composite decisions on that. All these real life situations can be looked upon by the people with this training. So these are the new courses which are really the country needs. We need the practitioners who has got this particular type of training. And that's why more and more of this type of undergraduate courses are going to be very important. And we need a lot of people, lot of students who may get
right. You are right. So you have rightly pointed out that nowadays that lifestyle diseases, that is a non-communicable diseases that is coming out. It was not that in 1950s, 1960s it was something different. The communicable diseases was more prominent, and if I kept some name like cholera, like in malaria. So at that point of time there are a lot of sufferer of that particular diseases. But contrary to that, nowadays that scenario is totally different. Now the communicable diseases are coming down. The number of prevalence of communicable disease coming down, and at the side that non-communicable disease or the lifestyle diseases like obesity, like cardiovascular diseases, like cancer, that are coming up. So there is a kind of rebalancing is going on. Although because of this recent incidents of this COVID, the scenario has got to some extent again disbalanced. So it's again a communicable disease, that COVID-19. So we thought that one upon a time the time will come that when that there'll be no communicable disease, it will be only the non-communicable diseases. But yes, this recent episode of these things that COVID that we have learned that yes, there is a balance kind of things between this communicable disease and non-communicable disease. So yeah, that is a important issue. And for non-communicable disease or lifestyle disease, there are a lot of things we need to maintain, and it is through that technology. And there is a lot of technologies that are coming up, but we'll be coming to that specs later on. But we have another specialist who is predominantly a ophthalmologist and optometrist. He'll be talking about optometry. What is the prospect of optometry? So I'll be requesting Dr. Majumder to share your views about the prospect of this particular programs, optometry. Dr. Majumder.
Very good afternoon to all of the panelists and the participants. In one word, the scope of optometry in today's day-to-day life is very vast. So I have prepared a small presentation so that the participants can get a visual and also the audio output. How is the current scenario? So I am sharing a slide. Can you see my slide?
Yeah, it is visible, but it should be very short. We have a very limited time.
Yes, it is very short. So I am from Susrut Eye Foundation and Research Center. So let me introduce my institution.
Go to the full screen mode, please.
Okay, sure. Okay. In the year of 1998, Dr. Sunil Chandra Bagchi and Dr. Ratish Chandra Pal, they at first created the Susrut Eye Foundation and Research Center with a motto to eradicate the blindness from the world. So in this journey, Susrut has found itself as one of the best tertiary care in the Eastern India. So we are, in one sentence, it is our great honor to record that the government of West Bengal has rewarded us by declaring Susrut Eye Foundation and Research Center is the center of excellence in the eye care in West Bengal in collaboration with Department of Health and Family Welfare of Government of West Bengal. So these are the branches all over the West Bengal we have. And
the objective of come to the point of our, the focal point.
Yes, I'm coming.
Yeah. What is the
objective of? Yes, the objective of our hospital is to provide eye care community service to one and all, irrespective of social or economical background. So we reach out to the people, and for this reaching out purpose, the optometrists and other assistants come in very handy. So they have a huge opportunity. The courses in the optometrist field in general are, as you can see, we have divided the course into two groups, first optometry and second paramedical courses. In case of optometry, we have diploma in optometry, we have masters in optometry, we have bachelor in optometry, and also there is internship and fellowship in optometry. And in paramedical courses, we provide vision assistant, eye mitra optician. This is an optician course, so that a person can easily open the optical shop, he can prescribe glasses, and if required, he can...
Dispensing will be their job, basically.
Yes. So also there is operating theater technician. As we know, there are so many operations in ophthalmic setup, so we need so much of technicians to perform it and to help it. So medical equipment technician, also they handle all the medical equipments. If there is any faulty, they can repair it. Also there is certificate program in ophthalmic care technology. This is called OCTC. And also anesthesia technician and masters in hospital administration. We provide this course in collaboration with the West Bengal University of Health Science.
That means you are affiliated to the West Bengal University of Health Science, right?
Exactly.
So what is the prospect of this course? MHA, you have mentioned, when students are getting job, and what is their basic salary structure, or what is their growth, different what I can say structure. So just if you just share a few words of that.
So at first we can come into the diploma in optometry. So diploma in optometry, what does they do? They basically does the refraction. They give power prescription to the patient. As we know that 1/3 of the world population blind people lives in India, and the number of ophthalmologists are very much less. So there is a gap between the healthcare provider and the original downtrodden people. So to bridge this gap, the optometrists come in handy. So after completion of this course, students are competent in managing patient independently. That is the key. They can go to a center, they can sit down and manage the patients. No need for any doctor or like that. If there is any complicated case, they can send the patient to us. So basically, they are the first line of treatment between the patients. So, and there is internship and fellowship in optometry. Internship and fellowship, what does we do? After the course completion, we just give the real on-field experience to them, so that they can become confident and they can deal with the patients. And also, if the student is very much eager to carry forward his research and also the training, they can go to the M.Opto, Masters in Optometry. So there is diploma course, there is bachelor's course, there is master's course. Also after that, they can go for internship or fellowship, anything. And also we have vision assistant or eye mitra optician. This is a very interesting prospect. So it is an 1-year course where students are taught basics of eye, refraction, and basic knowledge. After the completion, the students are competent enough to open their own optical shop. So this is a self-sufficient option. Patient, if they want, in the nearby bazaar or market area, they can open their own optical shop and treat the patient having refractive error, only the refractive error. They are not permitted to treat any diseases. They just treat the refractive error, give glasses, and if any other serious condition arises, they can refer it to us. It is same employment and establish themselves in the community with social service. So as you can see, this is basically we train them for a business point of business. So they can open up their own business, and as we know, they can succeed. They can succeed in this field according to their expertise. And also we have paramedical courses, operation theater technician, OT technician, medical equipment technicians. They design the biomedical equipment and devices and machines for diagnosing medical problems, install, adjust, maintain, repair, and provide technical support.
Right. So, Dr. Majumder, tell me one thing. It has been said that in the WHO website also it is also mentioned that there are globally 2.2 billion people have near or distance vision impairment. Right.
Exactly.
What that job these people can do, this optometrist, we are basically focusing on that optometrist as a program. So optometry as a program. So what is their role in curbing that particular statistics, say 2.2 billion people. So it's a huge number. So
yes.
This optometrist can take part to curb this number?
Exactly. If we analyze these 2.2 billion people, we know that 60 to 65% of these people are suffering from refractive error. That is, they have uncorrected refractive error only. If we treat this patient by giving simply glasses, minus or plus any glasses, they will be cured and they will be able to do their daily day-to-day activity, their professional activity. And this huge burden on the society of these 2.2 billion people, that can be the 60% of this can be eliminated. So, as we know,
you want to mean this is a preventable blindness. Preventable blindness in the sense, if proper actions can be taken in time, that we can tackle that number, right? And I believe the optometrist has a very significant role in that particular area. Right. So, but we'll be trying to focus the next, that the nursing program. So also that is also in our agenda. That what is the prospect of nursing? Do you have any nursing program in your place?
Yes. We have lots of nursing program. We have this operating theater technician. These are OT technician, specifically
we
the
are talking about
girl
nursing,
child.
Not OT technician. We are talking about nursing. So do you have that nursing program?
No, not specifically nursing in general sense. That is the one GNM like that. No, that nursing training is not available as for now here. But we train about the assistants in the OT, like they learn about the assisting different kind of procedures. Like there's a huge field. There is some in every city there is one or more eye hospitals. So there is a huge demand of these OT technicians who can properly assist in the OT. So we teach this specifically girls from the very backward areas of the West Bengal.
Coming to next to that, so if I should add, if nobody is talking about nursing, I can focus on something about the nursing. Nursing is one of the another important area, but there is a tremendous growth in the sense in terms of employability, in terms of what I can say, that earning capacity, whatever it is. It is not only India, in different other countries. Even I should also mention that India is one of the important I can say important source of this nursing people to the entire other part of the country. Like we are sending nursing people UK, US, and Saudi Arabia and all. So there is a BSc nursing program in different university, like All India Institute of Medical Science. They are having BSc nursing, like VCMC below. They are having nursing schools. Even in our West Bengal, that that different medical colleges. Either maybe it's a government medical college or private medical college. They have all started this nursing courses. So nursing is nursing people are the backbone of the entire healthcare. Right, so the doctors are giving probably maybe the 5-minute care, although it is vital. But at the same time, the remaining part of the day, that is the nursing people, they are giving the care. And I believe this is a very noble profession, and that BSc nursing has tremendous importance, and a lot of people are now engaging themselves in this particular program called BSc nursing or GNM something else. But GNM and auxiliary nursing midwiferys and other ANM or kind of things, probably that government or the Nursing Council of India is coming with some kind of norms that probably they will not continue this GNM GNM or ANM kind of program. So BSc Nursing, MSc Nursing will be probably that mainstream course for nursing in coming days, right? So Dr. Banerjee, do you have any? What is the plan of the government? Why they're interested not to continue with GNM or ANM kind of programs? Rather, they are focusing more on nursing.
Yeah, actually, first of all, I would like to highlight that the students who are appearing this session, they should understand that, and they should go through the West Bengal University of Health Sciences, WBHUS, University of Health Sciences, who have a very good guideline in their website about the affiliated courses regarding nursing, the colleges, both private and government sectors, where these recognized courses are being conducted. So there are basically two types of courses available. One is for bachelor's degree and another is master's degree. So many of us do not know even that even master's degrees courses of nursing are already available in our country and in our own state, beloved state. So bachelor's degree, like as you rightly said,
I think also the post BSc nursing is there.
Yes, sir.
Yes,
in
right.
bachelor's degree, there is BSc nursing as well as post BSc nursing. So BSc nursing, like these are available in the Government College of Nursing, Ramakrishna Mission Seva Pratishthan, MS Ma Sharoda College of Nursing, Charnock Healthcare, as far as I remember. Post basic BSc nursing courses are also available in ID and Beleghat BG Hospital Campus, Ma Sharoda Government College of Nursing, Medical College Hospital, Kolkata. So and what is important that once they pursue this course, even if they are academically interested, they can also go through the master's degree, which is a higher version, and there is super specialization in the field of MSc Community Health Nursing, MSc Medical and Surgical Nursing, and MSc Pediatric Nursing, which has also been introduced, and
Right.
MSc Psychiatric Nursing. So very corporate hospitals, they have, and like in Antara is a psychiatric hospital we know in the Newtown area.
Correctly pointed out, Dr. Banerjee. Yes, I know. Along with this, I should add one thing, that emergency and disaster nursing is another new branches coming up.
Yes. So there, these people can be recruited, can be hired, and they are very offering a very good scale, very good salary, very good packages, attractive packages. And this is not only that; it is not only about package, but there is a very high respect. That is also, I will say, because if you are super specializing in a specified branch like pediatric nursing, the sectors, the opportunities you have, maybe there are few colleges, few hospitals, but they are coming up like anything, and you will be one of you will be out of the, I mean, from others you will be different. That's why I encourage that people who are already doing or who are interested in nursing courses, they can always think about that. Not only BSc but also MSc in nursing. So lots of potential.
Right. So, Professor Chattopadhyay, what is your view in this particular, saying that artificial intelligence, nanotechnology are also coming up, very, as an intrinsic part of, healthcare. Very recently, I have seen some product of, Siemens and Wipro. They have, made, some, product of their own. They have given, a different, name like, Lily and something like that. So it is nothing but an artificial robot, so that also have a lot of, health implications. So when you are purchasing a software, from maybe Siemens or maybe Wipro or similar kind of another organization, they are giving some kind of a package to you, and that particular software and making your life easier. So they're making what your vitals on a very stringent way, and everything they are giving in a side by side, whether your BP is low or your pulse is distorted, something like that. So this is making a part of our life. So artificial intelligence and healthcare, what is your view?
If we look forward, that in 5 years of time, I can tell you that there's artificial intelligence is going to play a very vital role in this healthcare technology, because from this particular period of time, what we actually understand that to analyze the data which are being accumulated so much, and interpretation followed by when we are talking about the intervention, all these three are going to be very, very crucial for healthcare.
Right.
And these things are actually going to be taken care in a very big way with the help of artificial intelligence. Because that component itself is going to give us the tool to make us more objective rather than the subjective interpretation of different results.
Right.
To give you one example, right now, when we are talking about this, say, for example, the COVID testing data. This COVID testing data was found to be very crucial right now to find out that what are the possibilities of the wave to go down, a new wave to come. All these things are there. Now, with the help of this intervention of artificial intelligence, we can actually understand a lot of things which normally we predicted in a wrong way. So this is just a start, but artificial intelligence, the different types of chips which are going to be developed, which will actually help the whole biomedical instrumentation completely in a different manner and accessible to the people who are not actually afford to go to many sophisticated centers for all the different types of analysis.
Correct.
That
Correct.
means taking care of the cost part also. AI intervention is going to be very important.
That's great. That's great. Not only that, in artificial intelligence, there are 3D technology. The 3D technology is also...
That is actually an offshoot. Yeah. So this 3D technology in the whole area is going to revolutionize our understanding.
Yes, especially where the organ transplantation is required, so that organ cost and getting a organ from other donor is very tough nowadays. Many a time it not suffice the rules and regulation of that country. So therefore this 3D technology probably can create some kind of revolutions in this healthcare industry, and we can get healthcare cost as a very nominal way at economic rate. And I believe that India is having a lot of potential. If we just see that healthcare structure and that rate or the price of healthcare in India, and if you compare that with some developed country like US and UK, so we are at a very economic rate. Say for example, if I give one example, the knee replacement, the cost in India on an average is for 4 lakhs, but if you go in US or UK, it is 64 lakhs. So you can see how many times that cost is there in that place. So that is the reason medical tourism is supposed to be a boom in our country in coming days. So medical tourism, telemedicine, these are another new areas where in coming days I am very sure that different university will start this kind of programs.
Yes,
now,
India is considered as the hub of medical tourism, with millions visiting the country for affordable quality treatment from the neighboring countries.
Right.
Absolutely right. And that point is very important. Why we need this paramedical courses introduction and its actually implementation is very, very important now, because we need this type of trained people. And so the advanced country infrastructure versus if you look at our country in the healthcare sector, we must have skilled paramedical technician along with the clinicians. You're absolutely right, which is very, very important.
Right. Another program I should also point it out that clinical psychology. Clinical psychology is also getting momentum. The reason being, when we are in under lockdown conditions, many people are suffering from this particular disease. The loneliness, stress, and many a time they are frustrated with a lot of things. So that clinical psychologist is having a very distinct role in this particular domain. And I'm very sure that in coming days, a lot of university and a lot of people will be joining this particular program, clinical psychology. In different universities, they have bachelor and master level of programs of clinical psychology. By the way, we have started getting a lot of questions from the aspirants. What I can do, we can address these questions one by one. So first question I got from somebody, he is asking that what are the skill set that help one decide to pursue a career as a radiologist. I want to mean that maybe he is interested to make a career as a BSc radiologist or medical imaging technologist kind of thing. So who can Dr. Banerjee, can you address this question, please? I believe Dr. Banerjee somehow has gotten disconnected. Sir, Professor Chattopadhyay, can you tell us something about what are the, things?
Yes. So, that as I am mentioning to you, the medical radiography and the imaging technology, this undergraduate course, the need for the requirement eligibility is just a 10+2 with qualification in mathematics, chemistry, biology, and physics. So these 4 subjects but the knowledge of physics is very, very important over here, because here you have to actually do a lot of different things which are related to different principles based on physics.
Mm-hmm.
Now,
medical physics or radiation physics is very
exactly.
important.
So, the course curricula, which includes the in-depth study of this radiographic and image processing techniques, or the conventional radiological equipment, the special radiography procedures, and all these things are going to give this particular profession as one of the most sought after the healthcare sector. I just want to mention to the student that that a student can opt to do further specialization in the field of interventional radiology, bone densitometry. The bone densitometry is becoming very, very important as we are talking about this lifestyle disorders. Then the angiography, the basic X-ray. Now, these graduates of radiography and imaging technology can start their own laboratory on the basis of the license granted by the government. So if you have this particular training, that will open up a large number of areas where you can really do specialize and do something for the society itself.
Right. Thank you. Our next question, should I ask, Dr. Majumder?
Hello. Just I would like to add one thing that radio technicians regarding those things were saying. Okay, yes, already sir has explained very nicely. But at the same time, I am saying for all this, which is not only radio technologies, but for all these courses of lab technologies, you need immense dedication, disciplined, and focused. And you can expect some long duty hours because it's a healthcare sector. We cannot say that it will always be a 7 hours or 8 hours duty. For requirement of the patient to maintain that kind of turnaround time and service, you have to be on your toes every time. So you have to be hardworking enough and passionate about this. And that is the most important. Thank you.
Our next question is that that somebody is asking us that what are the course he or she should pursue in order to make a career in pathology lab. So already so it is know that it is BMLT kind of program, BSc Medical Lab Technology. Different universities having that programs, and after that there are also master degree also on MMLT. So anyone can pursue this in a BMLT kind of program. And what is the requirement of BMLT? Maybe in some university they're asking 45%. In some university they're 50% of marks and 10+2 with a combination of that biology, or mathematics and physics and chemistry. But in some university, the percentage of the marks is different. In our university, in Neotia University, 55% is the basic requirement, to get entry. So the next question goes to you. That the next question is, due to immense pressure of COVID cases, how difficult it is to deal with the day-to-day activities in job related to diagnostics?
Exactly. That is the warning question of the hour. How to balance between these things. So we'll say that in the healthcare facility, we cannot deny the fact that we have to go in close contact with the patients, and we don't know the status of the patient actually, whether he is positive or negative. We have to take the risk, but at the same time, we should know that this profession is very much fulfilling and satisfying. That at the time of the need of the patient, when everything is closed, he or she cannot go anywhere. You are there to fulfill their needs. So I would say that always there is a scope for balance between the job and the other lifestyle, but you have to do some sacrifice in order to keep the mentality of service.
Okay, that's great. So we are having just less than 10 minutes time in our hand to conclude. So I can accept maybe one or two more question only. So the next question is, what internship opportunities are available in physiotherapy? Can you address this question? Dr. Majumdar?
At least our hospital doesn't provide this kind of course. I think Dr. Chattopadhyay will be your university might have provided this kind of.
I think physiotherapy is not there in the SNU, so it is there in TNU, that is Neotia University. Let me address this question. See, physiotherapy is a very another very important and prospective programs in the different universities. So physiotherapy is almost as per the norms of the the regulatory authority, there are 6-month minimum internship is required. So a lot of healthcare institutions or hospitals, they are providing this internship maybe a free of cost, or maybe some amount they're charging in some places. But physiotherapy internship is available almost in all hospitals where there is a specialization of neuromedicines or neurosurgery or orthopedics. In all these hospitals, there is a possibility of physiotherapy internship. I think that is the questions. Probably we have given that answer to that question correctly. Now the next question, what I'm getting from that viewers, that I'm interested in career in paramedics, but I am confused about the subject to major in. What are the most flourishing options available? So, Dr. Banerjee, can you give the answer of this question?
I think, see, it depends on whatever the paramedical courses are available, be it nursing, be it laboratory technology, optometry, everything you can improve if you have that kind of dedication and passion. In view of choosing the career, you will have to first understand better. You can go through the courses, and you can fit it you yourself within what kind of curriculum attracts you. But if you are I think laboratory technology also is a very good option. You can also go for optometry, because sir Dr. already said that you may open your own clinic optometric shop also. So that way it is good. And also for nursing staffs, it is always you have the higher academic interest, in view of you can just upgrade yourself from BSc to MSc. So all courses are like that. We cannot compare like that. Right. Everything. Right. Yeah.
So you want to mean that all courses is having its own importance. Yes. So you can choose anyone. Only thing is that all are good. All the courses are good. You need to choose your desired one, and you can excel in that particular program, right? If you're
right
doing good marks.
One thing I would like to add, like you can to the person already there in the field. So if you are interested in the physiotherapy, just go to your nearest physiotherapist, talk to them what are the pros and cons of the field. Also you can go to the optometrist, what do you feel about that? Then decide for yourself. Don't get influenced by other people. You can take decision by yourself. That is the case.
Correct.
True. Correct.
So, Sir Professor Chattopadhyay, my last question to you, Professor Chattopadhyay, are you there?
Yes.
So my last question, because we need to wrap up, because just 5 minutes left. So we have discussed a lot of things. So there is a important things that is coming up in our picture, that this term, the paramedics or paramedical, is no more is viable. So in different country, in developed country like US and UK and New Zealand and Australia, they have using they're using a different terms. They're calling it a health science. In different university, they are calling it a health science. Initially, maybe say 10 years back or 5 years back, this term was very important and very prominent, that paramedical courses. Now they're giving a different term, health science, right? So how India is accepting that, and how your university is accepting or making it all these changes? Is it acceptable to you, and you are making the changes accordingly, or you are just keeping as it is paramedical courses?
Thank you for asking me this question, because this is the thing which we are discussing right now in university. We have the School of Life Sciences, which has got biotechnology, microbiology, applied nutrition, dietetics. Mm-hmm. We have the supportive departments, where Department of Pharmacy, Department of Nursing. But right now, we understand that it is very important to restructure the life science, School of Life Sciences, and change it to School of Health Sciences, which covers all the different things. we now understand how important, say, the one which we have not mentioned so far, but dietitian, the nutritionist, they are also very, very important right now. And this nutrition dietetics is going to be one of the major area, because that is going to help all the different healthcare systems in a very big way. So there are a lot of things. So absolutely, you are right. We have to think this life sciences from a completely different angle, encompassing all these things under the School of Health Sciences, where paramedics is going to be the one of the major components.
That will be included, right?
A major component, actually.
Yes,
they
right.
are going to be very important.
You'll be happy to know that our university, that Neotia University, we have transformed that name. We have now made that school name as Health Science. In 2019 onward, we have made the change. So it was initially Life Science, School of Life Science. So we have given a different name, School of Health Science, and probably all major programs we have included under this Health Science program. So it was
very important.
Right. So I think we are just having 2 minutes times in our hand. If anybody is interested to say 1 minute or maybe in second, any important things to share with that aspirants, we can take it. Otherwise we can wrap up. So anybody, any panelist is having something special to say to the aspirants, if you can say that in a few seconds.
I just want to mention right now that the students right now should look at that it's not that medical is the only profession. This whole health science sector is going to be a very, very important profession. And these are the things which are the demand for the day. And all of you don't jump for one thing. Try to actually explore your interest and your interest that you want to learn these things. There are a number of students when I interviewed, I find that my father is suffering from eye disorder. So they wanted to actually understand that. But this, how Dr. Jaydeep already mentioned to me, to all of us, that how important actually this particular field of study. Similarly, the laboratory technicians, the career science technologies, the nursing, everything is right now, nutrition, dietetics, everything are very, very important area to study. So there are huge career prospects. There are huge scope for you for actually understanding. And all these subject areas right now has got a prospect in research also.
Yes, correct. So take it forward, the word, what Dr. Chattopadhyay has said, that medical, that means MBBS is not the only solution, probably. If you are not, getting it through this MBBS or cracking that in a particular MBBS entrance, there are a lot of other avenues also. And that could be almost similar. Even in some cases, it will be more than even in MBBS programs. I have seen in my last 20 years of experience, in health sciences, I have seen that my students are today, they're doing marvelous. They are, getting job, even somebody is getting in crore. So, and they have done maybe some hospital administration, maybe optometry, physiotherapy, and they're doing a very good job. So this health science is a new emerging area in the coming days. And I believe that all of you can get a very, prospective and a desire, kind of in a career in future if you pursue this health science programs. And just I should conclude by saying that we have seen different time of recession. The healthcare is one of the recession-proof industry altogether. Even in the time of recession, we have seen there is no dearth of employability in case of health sciences. So health sciences is evergreen, ever growing, and it is one of the largest and fastest growing industry in this entire world. India is touching this $400 billion in the industry in healthcare in coming 2022. So we hope that all the aspirants got some idea about this particular programs. And if you have some more questions, there are a lot of other questions is coming up. I cannot address all these questions because time is limited. So you can post us in that ABP Education. So any of us who are present today can address your questions in coming days.
Definitely.
We wish all the best to all the aspirants, and we wish that you should get a very good and a prosperous career ahead in health sciences. And I should also thank you, all the panelists, who joined today with me to give that insight on healthcare, or health sciences as a career. Thank you, all of you, and for your insightful, discussions. And I believe, there is a tremendous benefit that aspirants have got from this discussion. So thank you, all the best, to all the, aspirants and our panelists. And obviously, I should, thankful to ABP Educations for arranging such a wonderful program for the benefit of the would-be, healthcare professionals. Thank you very much. Have a nice day.
Thank you.
Thanks to the wonderful moderator.
Thank you.
Yeah, really.
Thank you very much.